Hi everybody, welcome to Dr Manny's YouTube Learnshops. This is an introduction to what is behavioural science. The learning objectives for this session are that you'll be able to explain the concept of behavioural sciences, name the various disciplines that utilise behavioural sciences, rationalise the importance of integrating behavioural sciences to a person's health, and I want you to think about it. I really do. I want you to think about behaviour as a science. I think before we look at what behavioural sciences are, we have to understand what is meant by behaviour. Now, behaviour is a response of an individual or a group to an action, the environment, or some form of stimulus. In actual fact, behaviour is everything that you do. It's everything that a person does. And behaviour can be observed, you can see it. You can hear it, it can be heard. You can see it, and you can measure it. Behaviour is a function of the person's characteristics and the characteristics of that surrounding environment. That's behaviour. You have to understand that. And you all probably already have an idea of what behaviour is. Behaviour can be classified in relation to certain characteristics. Behaviour can be inherited, or behaviour can be learned. Look at this example. Well, this is an inherited behaviour, possibly. Well, he certainly has his father's nose. Or it can be learned. How about a quick espresso before school, Toby? The father says to the son. And you look at the child's behaviour compared to the father's behaviour. There are 4 learned characteristics that are recognised. And those are perception, personality, values, and attitudes, which we'll review. Perception is the first one. Perception is a way of regarding or understanding or interpreting something. It's your mental impression. It's from you. It comes from your senses. Feeling, seeing, hearing, touching, and smelling. So for example, if you perceive that your elderly patient isn't able to do something, even though they probably are, you might perform that task for them, even though they're quite capable of doing it. That's an impression of perception. Perception, look at the characters. Perception is an understanding in one's own perspective or situation. So for example, when you observe something, look at the number. If it's facing a certain direction, it could be seen as a 6, or it may be perceived as a 9. I always look at the glass as being half full, a positive response, rather than half empty. It's your perception. Then we look at personality. Personality is the combination of characteristics or qualities that you have that make you you, that form you as an individual. So for example, you could have a type A personality, energetic, outgoing. You want to achieve something because it's there. However, if you have a type B personality, well, you may not want to do the same thing as the person with the A-type personality, and you view it differently. Type I personalities seek challenges. Type B personalities just do what everybody else does. They seek the status quo. Which one are you? You could be a combination of both. Then we look at attitude. You're going to see this in your career. You've probably already encountered it in your life. because none of you are children. Attitude is a way of thinking or feeling about someone or something. And typically, it's reflected in the person's behaviour. You can have a positive attitude, or you can have a negative attitude. For example, you've chosen to become a nursing professional. So have a positive attitude. I love being a nurse. I love going to work. When you start doing your clinical practicums here, don't moan and groan. Be positive. Love going to work. Love looking after your patients. Be positive about it. Love being a nurse. That's why you chose nursing as a career. If you don't want to be a nurse and you have a negative attitude, this will impact on the care that you give to your patients, the people that you work with, and yourself. Look at values. Values are moral, ethical principles. They're beliefs or accepted standards of a person, you, or the social group that you interact with. It's about good behaviour. It's about what's important. And for example, two values that I always promote are patient advocacy, because if you are a patient advocate as a nurse, as you should be, you promote patient safety. You promote quality care. The best way to think of a patient or a nurse is as it says in the image. Be the nurse you want as a patient. Because one day you may be a patient. And maybe one day you may want a nurse that cares about you. It's a very important role. So what about our behaviours? What moulds our behaviours? What makes us be who we are? Our behaviour, at the pinnacle of the image in front of you, is created by a number of steps, a number of features, a number of aspects. At the bottom, you've got your culture, your faith, your level of education and experience, mentors and role models that you've had. These 5 components form our beliefs, and our beliefs form our values, and our beliefs and values form our attitudes, and our beliefs and values and attitudes create our behaviour. Now, these are just questions as we go through every one of my lectures I want you to consider, because they are going to come back, not to haunt you, but they are going to come back in certain quizzes, assignments, presentations, and examinations. So think about them now. What makes us who we are? Is it the genetics that we're born with? Or is it the experiences that we encounter in our life? What makes us who we are? Is it genetics? Or is it experiences? Or is it both? So now we'll move on to what is behavioural science. Think of it like this. I love this picture. This woman's amazing. Suppose you've got a patient. She's 68 years old. And she says that she's always stressed. She's hypertensive. She's overweight. She doesn't exercise. She smokes 20 cigarettes a day. And she's been doing that since she was 20 years old. She came to your clinic because she's got constant headaches and she can't sleep. And as a professional healthcare provider, you want to help her. So what you do, one major goal that you have to encounter is to address her risk factors for cardiovascular disease. But you want to make sure that at the same time you relieve her current chief complaint, which is that she's got headaches and that she can't sleep. And at this stage, all you can do is give her advice about the risks related to cardiovascular disease. You can not lecture her, but you can advise her about the benefits of exercise, weight loss, healthy eating, and stopping to smoke cigarettes. After which, you, as a healthcare professional, would refer her to a doctor for reassessment, and possibly for the doctor to prescribe anti-hypertension medications, because you don't want your patient to have a stroke. Because with those headaches that she's having, possibly this is what's impending. She thanks you very, very much for your advice, and then she goes home. But, now think, but, will your recommendations really work? Will she comply with your recommendations? I mean, will she exercise? I mean, will she eat a healthy diet? Will she go to the doctor? If she's gone to the doctor, will she comply with the medications that the doctor has prescribed? And how can you know that she will? So what are the advantages and disadvantages for complying or not complying with your recommendations? Think about them. That's what you have to do. As a healthcare provider who's looking at behavioural sciences, because behavioural sciences provides a basis for you as a healthcare professional to address the questions raised in this scenario. And the scenario is a common one. I'm sure you have people, whether they're family members or friends, which are in a very similar situation. And the primary focus is to improve healthcare delivery to your patients. Your role is really important, and behavioural sciences can make you more effective as a healthcare provider. So, what's behavioural science? Behavioural science is a social science, which means it deals with society. And it derives its concepts from observation of behaviour, from living organisms. We're talking about human beings. But you can get the same information about looking at an insect, or an animal, or another living thing. Behavioural sciences simply defined as the study of human habits, actions, and what the intentions are. And it combines the knowledge of psychology, sociology, and anthropology with observation, evidence-based research, and effective communication skills. A behavioural scientist, which I believe nurses are, many other academics do not, examines behaviour and decision making from individuals and communities. And I think we do that. As nurses, I think we do that. Now, there are 3 spheres that are related to behavioural sciences. And these are, which I've already alluded to, psychology, which focuses on the individual; sociology, which focuses on society; and anthropology, which focuses on culture primarily. However, there is a 4th sphere which academics consider, and this is related to genetics. And genetics, as we mentioned previously, and environment, which we mentioned previously, which is about learning or experience, creates behaviour. So genetics essentially is what you're born with. The environment is what you're exposed to and what you learn as you grow. My personal belief, as I was growing up here, I always had the belief that you're born with what you have. I mean, if you're going to be a rocket scientist, you're born with an incredible brain. However, with my life experience, I've learnt that probably environment is probably more important. An environment probably has a greater effect on your behaviour. I mean, if you're constantly in a situation where you're being abused and you're being hurt and you're being injured or you're being psychologically maltreated, you might end up becoming a psychopath, even though you were never born to be a psychopath. Interesting concepts to consider, which you will as we go through this program. When we look at psychology as the first sphere, psychology is the scientific study of the human mind and its functions. And it focuses on the individual person, not the group. It's an individual. The psychiatrist or the psychologist focuses on the individual. Question to consider. You need to consider it because this will come back to you as we go through this course. Do nurses need to understand psychology? And you should consider your answer and be able to explain why. Sociology, the second sphere. And this is the study of the development of structure and the functioning of human society. This is about groups, and it focuses on groups of people belonging to that society. And you're going to see a lot of this as you go through your program, not just in behavioural sciences, but in most of the other courses. Question to consider. Does peer pressure and social media influence our behaviours? There's a fact. Social learning, and we'll discuss this when we look at some of the theorists at a later point in time, has demonstrated that children learn aggressive behaviours simply by observing another person acting aggressively. So if you've got a child, for example, who's constantly in an environment where their parents are fighting or they're abusing each other, then this will have an effect on the child. And their behaviours typically involve aggression. Another question to consider. Do you as nurses need to understand about groups of people? Understand sociology? If so, why? The third sphere is anthropology. And anthropology is the study of what makes us human. And it studies people worldwide, primarily their history, their communication, their socialization, which has an effect on their behaviors. It focuses on biological features that make us human, the physiology, the genetic structure, evolution. But it also includes other aspects related to language, culture, politics, family, and religion. The different fields of anthropology, which I alluded to just a moment ago, deal with culture, history, language, and evolution. Cultural anthropology, archaeology, linguistic anthropology, and physical anthropology. Do you as nurses need to be anthropologists? I don't think so. But do you need to understand anthropology? Yeah, I think you do. Because look at the culture that you're living here in Malaysia. It's multicultural. Most countries have got a multicultural environment. However, I think Malaysia seems to make it work better than most other countries. And we'll be looking at this in greater detail as we go through. And when you go into the next semester, looking at social sciences. And then in the next semester, looking at social sciences and health. If you believe that nurses need to understand anthropology, you should be able to explain why. When we look at behavioural genetics, the fourth sphere, well, this is the study of the influence of genetics, or what you inherit from your parents, or the environment, and what effect it has on behaviour. What do you think? What do you think has got a greater influence on behaviour? Is it genetics, or what you inherit, or is it environment, or is it a combination of both? Do inherited traits or life experiences play a greater role in shaping behaviour? Is it what you inherit genetically, or is it what you experience in life? And looking at the cartoon, you've got two parents and you've got a child. And the father's basically saying, sorry to break the news to you like this, son, but you're not adopted. Because the child obviously can't understand why he's so different from his parents. Questions to consider again. When a person achieves success, did they do so because they are genetically predisposed to be successful? Or was it the result of hard work or the environment that they were exposed to? Consider as well, if a person abuses his family, is it because they were born genetically with violent tendencies, or is it something that they learned by observing their own parents' behaviour? Another question to consider. Just look around you here in Malaysia. Just look around you here in Sarawak. Just look around you here in Kuching. If a person smokes cigarettes, even though their parents got lung cancer from smoking cigarettes during their life, is this a learned behaviour, or is it genetic or inheritary? Questions to consider. Do you as nurses, as healthcare professionals, need to understand the concept of nature, which is genetics, or nurture, which is what you learn from your parents, your family, your societal group? Do nurses need to understand the nature versus nurture theory, which we'll be looking at a later point in time? Think about it now. And if so, why do you think so? Another question to consider is, what is a health behaviour? What is a behaviour related to health? Well, health behaviours are a person's, yours, beliefs and actions regarding your health and well-being. They're absolute factors which maintain a healthy lifestyle. They're influenced by society, your culture, and the environment that you live in and work in as well. And they're shaped by your individual choices, maybe even peer pressure. Health behaviours promote health and hopefully prevent disease if they are positive. And they're influenced by social and cultural norms. What are behaviours in relation to the relevance to health? Well, behaviours can be the cause of certain illnesses and how illness presents and how the care for that illness is delivered and received. And this can be related to social and psychological treatment. It's about nursing care. Let's look at health-related behaviours. There are health-impairing behaviours as a consequence of certain pathogens. And the pathogen examples could be cigarette smoking, alcohol or drug abuse, a high-fat diet, promiscuous sexual behaviours which could cause AIDS or HIV, or sexually transmitted diseases, unplanned pregnancies, or just being sedentary in your lifestyle. Health protective behaviours, which are referred to as immunogens, are, for example, regular exercise, seeing your doctor on a regular basis, not smoking, not taking alcohol, watching your diet. Then you've got illness behaviour. And illness behaviour is aimed at seeking remedies. We'll be looking at that shortly. For an example, you may go to the doctor because you don't want to get sicker than you are already. Then you've got the sick role behaviour. And sick role behaviour is something that society expects. So sick role behaviour is what's expected of a sick person. And when you're sick, you're supposed to be compliant with medical orders and medications. You're supposed to follow your doctor's advice. What then is illness behaviour? What you behave like when you are ill? Well, illness behaviour is when you're feeling unwell. It's behaviour that you do in a certain way, in an unwell way. Illness, theoretically, is a psychological concept. And it's different for everybody. It's subjective. It can be physical, it can be emotional, it can be social, or it can be spiritual. And it may not be associated or synonymous with disease. Only the person can say if they are well or unwell. It's very individual. You may have two people that have exactly the same illness, however, they react or behave differently because they're individuals. For example, if you take two different nationalities, look at the Swedish, or the Swiss, or the German. very staunch, very tough. If they have pain, they don't typically show it. You can't read it on their facial expression. Using one of the pain tools, which deals with physical assessment, you may not be able to determine that they have pain because their societal upbringing is different to, for example, the Italians or the Greeks or the Arabs. They have a very close family network. Their mother is very, very important in their life, and possibly here now that they demonstrate pain much more easily, emotions much more easily. So there are certain nationalities that are very emotional, and there are certain nationalities that are not emotional. They will have a different behaviour related to exactly the same problem. Factors that influence illness behaviour are your age, your gender, your culture, religion, how much education that you've had, and your past experiences. The seriousnesses of the signs and symptoms, and you, how you tolerate those symptoms. How bad the illness is. Is it minor, moderate, or serious? Does stigma come into it? Because community opinion of illness is important, especially in Malaysia. If you have mental illness here in Malaysia and other countries as well, not just Malaysia, people are very hard. People are very uncaring. So community opinion of illness is important. What about availability of medical services and treatment? Another issue in Malaysia. Or does the patient or the person who's ill trust the medical services or the healthcare providers? I think after the COVID situation here in Malaysia and most other countries, they will trust them a lot more. When we look at illness behaviour, I've just chosen one of the models. This is Suchman's 5 stages of illness behaviour, but there are numerous. This one is one of the most straightforward. And it deals with symptom experience, which is followed by the assumption of the sick role, medical care contact, dependent patient care role, and recovery and rehabilitation. In stage 1, you're experiencing symptoms. You are aware that something's wrong. It could be a physical experience with pain, a rash, cough, fever, bleeding. It could be a cognitive or thinking experience where you're interpreting your symptoms. Oh, I'm having chest pain. Oh, am I having a heart attack? It could be an emotional experience because you're worried, you're fearful, or you're anxious. And it's during this stage, experiencing symptoms, that the person tries to help themselves. You try and help yourself. And you'll seek medical advice if you can't do it yourself. So for example, if you're coughing, and you take some herbal remedies, you take cough drops, you take cough syrup, it's not working, then you may go and seek medical advice. Stage 2 is referred to as the sick role. And this is where the person accepts that they're unwell or that they're ill. And it's an accepted role in society. And people don't look at you and say, well, it's your fault for being ill. And when you are ill, you're excused from society for normal duties and role expectations. You're allowed to have sick leave. But it's expected from society that you get well as soon as possible. And you don't just do your own thing, you've got to seek professional help if the symptoms persist. You've got to go and see a doctor. Medical certificate. And that way, when you have your medical certificate, society says, okay, they are sick. They're not just pretending. Stage 3 is medical care contact. And this is when you, as the person who's sick, seeks help from a healthcare professional. It could be a nurse. Typically, it's the doctor. And this provides validation that you're really sick. And it provides an explanation of the illness, hopefully in simple terms. And it reassures the person who's sick that recovery is the outcome. However, the patient either accepts or rejects the diagnosis. They may say, well, I don't have this. And they may go to another healthcare professional. An example would be, for example, not going to conventional medical practitioner. You may be looking at Chinese medicine, Indian medicine, tribal medicine, an alternative. However, if it's accepted, the person who's ill follows the medical plan. If it's rejected, as I indicated, they seek alternative healthcare provider advice, referred to as quasi-practitioners. Acupuncture, cupping, health remedies that are typically not accepted or evidence-based by medicine. Stage 4 is referred to as the dependent patient role. And this occurs after accepting that the illness is there and the medical treatment plan. And the person now becomes dependent on the healthcare professional for help. And it's important to realise that in doing so, people give up their independence because they do have role obligations, such as being a wage earner, a father, a mother, a husband, a wife, or even you as a student. Stage 5 is recovery or rehabilitation. And this is where the person resumes their former role and their responsibilities. However, it could be a problem for those people with chronic diseases if you've got, for example, diabetes mellitus, or you've got end-stage renal disease, or you've got congestive heart failure. You may have a disability like a cerebrovascular accident, or commonly referred to as a stroke. You may be a quadriplegic or a paraplegic with a spinal injury. You may have terminal conditions such as cancer or cardiac-related cardiomyopathies or chronic obstructive pulmonary disease. And these all require a major adjustment in their lives and their families' lives. How does illness impact on the patient or the person or you? Well, there can be behavioural and emotional changes, loss of independence or autonomy. There can be self-concept or body image changes, especially if you've had major surgery such as a mastectomy, or you've had to have something amputated because you have cancer or an injury. There can be lifestyle changes for the family. If you're the breadwinner or the primary breadwinner and you can no longer support your family, this will impact on your family. If you're constantly requiring medical care, this may be economically a problem. So therefore, the impact of illness on a patient depends on the family member who's ill. Is it mother, father, husband, wife? The seriousness and length of the illness. Is it terminal? Is it chronic? Is it acute? the cultural and social customs of the family. Is the female actually allowed to work? Should the male be working? These are all issues that impact on the patient who's ill. There'll be role changes, task reassignments. There could be increased demands on the person's time because their partner is ill. There's anxiety about the outcomes. Are they going to be able to go back to work? Is it going to affect them financially? There may be conflict in the family regarding unaccustomed responsibilities. It's not my responsibility to earn the money. That was your responsibility. It's not my responsibility to cook and clean. That's your responsibility. There could be financial problems because money isn't coming in every week anymore. Savings are being depleted. There can be loneliness as a result of separation. They may be in hospital. They may be in palliative care. And maybe there's the concern that they're going to die as a pending loss. There may be a change in social customs because of the illness impacting on the family. Let's look at disease in relation to illness behaviour. And you'll be covering this in other courses as well as you go through. But disease basically refers to the physical body malfunctioning. Whereas illness, as we said, is a subjective perception of how well or how good you feel. Here's a question to consider. Is it possible to have a disease and not be ill or unwell? What do you think? Well, consider you can be a diabetic and have diabetes mellitus. And you can still go to school, you can still go to university, you can still learn, you can earn your degree, master's, PhD. You can have hypertension, and as long as you're compliant with your medications, you should be okay. You can have cardiovascular disease, which could be chronic. You may have a condition where you have a cardiomyopathy. Still you can go to work. Still you can support your family. You may have cancer. So it is possible to have a disease and not be ill or unwell. Another question to consider. Is it possible to feel ill or unwell and not have a disease? What do you think? Well, there's a condition called hypochondriasis, which is referred to as an illness anxiety. You would know it as being a hypochondriac. A hypochondriac is someone who thinks they're sick and they're not sick at all. They're constantly going to the doctor or they're having sick leave all the time because they think they are sick, when in actual fact they're not. Hypochondria, or being a hypochondriac. Hypochondriasis, which is illness anxiety. Some people say it's a psychological condition. When we look at behaviour modification, it can have an effect on your lifestyle. So behaviour modification, as indicated in this diagram here, how much longer do I have before I have to change to a healthy lifestyle? This could be a common question. So for example, you've got people out there in the community, you may even be exposed to them. They're hypertensive, they've got renal problems, they may have had a previous stroke, they're overweight, they're non-compliant with their insulin because they're a diabetic, and they trust in hoping that nothing will happen to them. Human behaviour. Human behaviour essentially says nothing's going to happen to me, but eventually it does. And when something happens to you, then you decide to change your health lifestyle. But typically then, if you've had a stroke, it's probably too late. Or you've had a heart attack, it's probably too late. Or you're in renal failure, it's probably too late. Or you've got cancer on your skin because you haven't been using UV radiation protection, etc. Questions to consider. Again, is it possible to change a person's healthcare behaviour? And if you do, or if you don't, think about how you would do that. There's something called the health belief model. This is just one. And this is a psychological behaviour change model which promotes that to influence a change in behaviour, the person's got to feel personally threatened by the disease or illness, which means the person's got to be scared. They've got to be scared that they're going to have a heart attack. I had a colleague of mine here who was constantly having chest pain. Very heavy smoker. Cholesterol was elevated. He had to have a coronary angiogram, quite an invasive procedure. And it was only after the threat of having a heart attack or a myocardial infarction that he decided to do something about it. Lost weight, watched his diet, gave up smoking, no longer drinks alcohol, and he's much healthier. However, the person has to also believe that the benefits outweigh the barriers or the risks. The person's got to believe that by changing their lifestyle, it's going to benefit them. So the model suggests action by the person who is affected is triggered by their beliefs about their health problems, if they have them or they don't have them. The perceived benefits, good or bad. If there are any barriers or risks, is it worth it? Self-efficacy. Is it worth doing it? And there has to be a required stimulus. So something has to trigger it. As I said, my colleague, severe chest pain, thinking he's having a heart attack, and he possibly was, in order to change his lifestyle. The healthcare belief model focuses on three major factors: the individual's perceptions, the modifying factors, and the likelihood of action. So the way it works basically is, it depends on your age, your gender, your ethnicity, your personality, how much education that you've had, and how financial you are. These all impact on the perceived threat of the disease or your illness caused by the disease. Then, the demographic variables, your age, gender, ethnicity, personality, education, economics, they will now allow you to consider how bad the disease is. And after you consider how bad the disease is, then you'll decide whether it's a threat or not. And if you decide that it is a threat, there's going to be a likelihood of behavioural change. But in order to get the behavioural change here, you've got to perceive whether now the benefits outweigh the risks. And if they all work together, then here there'll be an action. And the actions are affected by internal actions such as your chest pain, your head pain, you're having a heart attack, or you're having a brain attack, or you're hemorrhaging. Or they can be affected now by peer pressure. You go to the doctor, you silly man. I mean, everybody goes to the doctor. Okay? Advice from others. This can be related to saying, oh, gee, your mother died of this so many years ago. It's in your family. It's a family history. Or, as in Malaysia, you're getting media information constantly about diabetes, hypertension, heart attack, stroke, etc. Or this could be from education that you've picked up. All these factors are involved in the healthcare belief model. So the components of the healthcare belief model are perceived susceptibility. This is the person's subjective perception of getting the illness or disease, what they believe. Then there's perceived severity. This is the person's feelings of how bad the disease actually is. If they don't think it's bad, they may not do anything about it. If they think it's really bad, they may do something about it. Then they've got to think about the perceived benefits. And this is the person's actions taken to prevent or cure the illness or the disease after considering the risks or the benefits. The perceived barriers. This is the person's feelings about the obstacles which prevent the actions for the cure or the illness. Look, they may be poor. They may be financially compromised. They may not be able to give up work. Then there's the cue to action. This is the stimulus needed to trigger the actions to prevent or cure the illness or disease. They're getting chest pain. They're getting head pain. They're getting abdominal pain. They're getting bone pain. And then self-efficacy. And this is the person's confidence in themselves to perform the behaviour. They've got to believe in it. They've got to believe that if they go onto a cholesterol-free diet or a low-sugar diet, that it's going to help them. They've got to believe that they are going to be able to do whatever they have to do to achieve a positive outcome. So if you look at an example I've put in here, have a look. You've got the three factors: an individual's perceptions, modifying factors, likelihood of action. And the yellow key interventions are to ensure healthy practices. You've got a 50-year-old male, he's Chinese, married, with 3 children, and he works really hard. He has severe chest pain, and he thinks to himself here, gee, maybe I've got heart disease. Oh, I think I'm pretty scared. I mean, I don't want to have a heart attack. I don't want to die. I don't want to leave my family. They need me. I need them. He perceives that this disease is life-threatening. So what are his cues for action? What's he going to do about it? Well, the cue for action to make him do something about it is that he's having chest pain, he's got dyspnea, well, he's got difficulty in breathing, and he's short of breath. Then he remembers that his father died of a similar condition, so he's got a family history. His wife and family, sister and brothers are constantly nagging him to do something about it because they're concerned. He listens to the news report about how here in Malaysia that heart disease is very high. So he educates himself about what is happening. Then he says to himself, well, if I do something about it, I'm going to be pain-free. and I'm not going to suddenly have a cardiac death, SCD. No sudden cardiac death. However, the risks are that it's expensive. And if I have any procedures related to my heart, they could be dangerous. Then he has to make a decision. Yes, no, or maybe doing something about it. That's the healthcare belief model. So questions that you need to consider are, does the nurse have a role to change a person's healthcare behaviour? And if you consider it, how? How would you do it? These are all questions that will come back to you in the future. Other questions to consider, and we may make this in the discussion, I haven't decided yet. Questions to consider, is it the nurse's role to identify the patient's health impairing behaviours? If it is, explain. Is it the nurse's role to explain the healthcare protective behaviours to a patient? Explain. Is communication important in the patient-nurse relationship? So conclusions basically are, nursing practices in clinical healthcare field do not ensure good health practices. Combining nursing knowledge and skill with behavioural sciences are complementary for effective healthcare. Focusing on behavioural changes for compliance to treatment, healthy practices and healthy lifestyle are challenges against prevailing chronic diseases. Here's a discussion question. Do you as nurses need to learn behavioural sciences? Something for you to reflect on. Thanks again, everybody. Check out any of the other Dr Manny Learnshops on YouTube if you're interested.